Question 1. The assessment process reveals a 5-year-old child with significant blunt force trauma to the abdomen following a motor vehicle collision. The child is conscious, but appears pale and is breathing rapidly. Considering the International Trauma Life Support (ITLS) framework, which of the following approaches best reflects the understanding of pediatric anatomy and physiology in this trauma scenario? Option A. Prioritize immediate aggressive fluid resuscitation due to suspected significant internal hemorrhage, assuming a similar volume deficit as an adult of comparable size. Option B. Administer pain medication liberally, as children are generally more tolerant of pain and less likely to develop shock from pain alone. Option C. Focus on securing a definitive airway immediately, recognizing the proportionally smaller pediatric airway and the increased risk of obstruction from edema or blood. Option D. Assume the rapid breathing is solely a compensatory mechanism for hypovolemic shock and proceed with standard adult protocols for chest decompression if indicated. The correct answer is A. Prioritize immediate aggressive fluid resuscitation due to suspected significant internal hemorrhage, assuming a similar volume deficit as an adult of comparable size. Explanation. This scenario presents a professional challenge due to the critical need to accurately assess a trauma patient where age-related anatomical and physiological differences significantly impact presentation and management. Misinterpreting these differences can lead to delayed or inappropriate interventions, directly contravening the ITLS principles of rapid, effective trauma care. The ITLS framework emphasizes understanding these variations to ensure optimal patient outcomes. The correct approach represents best professional practice because it directly applies ITLS principles by recognizing and accounting for the unique anatomical and physiological characteristics of the patient's age group. Specifically, it acknowledges that pediatric patients have different airway anatomy, a higher metabolic rate, and a proportionally larger head, all of which influence their response to trauma and the urgency of interventions like fluid resuscitation and airway management. Adhering to these age-specific considerations ensures that assessment and treatment are tailored for maximum efficacy and safety, aligning with the core tenets of ITLS. An incorrect approach that fails to consider age-specific anatomy and physiology is professionally unacceptable. For instance, treating a pediatric patient as a small adult without accounting for their proportionally larger head surface area leading to greater heat loss or their less developed thermoregulation would be a failure to apply ITLS guidelines. This oversight could lead to hypothermia, a significant complication in pediatric trauma. Similarly, assuming a pediatric patient's respiratory distress is solely due to lung contusion without considering their smaller airway diameter and higher respiratory rate, which can be exacerbated by even minor airway obstruction, represents a failure to adhere to ITLS principles of comprehensive assessment. Another failure would be to underestimate the severity of internal bleeding in a child due to their greater circulatory reserve, potentially delaying critical surgical intervention. The professional reasoning process for similar situations should involve a systematic approach. First, identify the patient's age and immediately trigger a mental checklist of age-specific anatomical and physiological differences relevant to trauma. Second, integrate these differences into the primary and secondary survey, actively looking for signs and symptoms that may present differently than in an adult. Third, tailor interventions based on these age-specific considerations, utilizing appropriate pediatric equipment and dosages. Finally, continuously reassess the patient, recognizing that their physiological reserve can be rapidly depleted, necessitating prompt and decisive action guided by ITLS principles. Question 2. Operational review demonstrates that a patient involved in a motor vehicle collision presents with a visible facial laceration and is complaining of neck pain. During the initial assessment, the patient is able to follow simple commands but appears disoriented to time and place. Which of the following actions best reflects the ITLS approach to assessing the patient's neurological status? Option A. Administering a full Glasgow Coma Scale (GCS) assessment, including eye-opening verbal response and motor response. Option B. Checking the patient's pupillary response to light and noting if the pupils are equal in size. Option C. Asking the patient to rate their pain on a scale of 1 to 10 and observing their facial expressions for signs of discomfort. Option D. Relying on the patient's ability to follow simple commands to determine their level of consciousness. Correct answer is A. Administering a full Glasgow Coma Scale (GCS) Assessment, including eye-opening, verbal response, and motor response. Explanation. This scenario presents a professionally challenging situation due to the critical nature of neurological assessment in trauma patients and the potential for rapid deterioration. The ITLS framework emphasizes a systematic approach to patient assessment, and accurately evaluating neurological status is paramount for identifying life-threatening conditions such as traumatic brain injury, TBI. The challenge lies in distinguishing between subtle neurological changes and overt signs, and in applying the correct assessment tools within the time-sensitive environment of pre-hospital care. The correct approach represents best professional practice because it aligns directly with ITLS guidelines for assessing neurological status, specifically the use of the AVPU scale and the Glasgow Coma Scale, GCS. These tools provide a standardized, objective method for quantifying a patient's level of consciousness and responsiveness, which is crucial for tracking changes over time and communicating findings effectively to receiving medical facilities. Adhering to these established protocols ensures consistent and reliable assessment, enabling timely and appropriate interventions. An incorrect approach that relies solely on subjective observations without utilizing standardized tools fails to meet professional standards. This can lead to misinterpretation of the patient's condition, delayed recognition of neurological decline, and ultimately, suboptimal patient care. Ethically, failing to employ best practice assessment methods constitutes a breach of the duty of care owed to the patient. Another incorrect approach that focuses on a single neurological sign, such as pupil reactivity, while neglecting a comprehensive assessment, is also professionally unacceptable. This narrow focus can overlook other critical indicators of neurological compromise, leading to an incomplete picture of the patient's status. Regulatory frameworks like ITLS mandate a thorough and systematic evaluation to ensure all potential issues are identified. The professional decision-making process for similar situations should involve a rapid, systematic assessment using established ITLS protocols. This includes immediate application of the AVPU scale, followed by a more detailed GCS assessment if indicated. The findings should be continuously re-evaluated and documented, with any changes communicated clearly to the receiving facility. Professionals must prioritize standardized assessment tools over subjective impressions to ensure objective and reproducible data, facilitating effective teamwork and optimal patient outcomes. Question 3. The evaluation methodology shows that a patient presents with a single penetrating injury to the anterior chest. The wound is approximately 1 cm in diameter with minimal external bleeding. The patient is conscious but appears anxious and is breathing shallowly. Considering the ITLS framework for penetrating chest trauma, which of the following best guides the initial management approach? Option A. Assume the wound is superficial and focus on pain management and reassurance, as external bleeding is minimal. Option B. Immediately initiate aggressive fluid resuscitation and prepare for rapid transport, recognizing the potential for significant internal hemorrhage and organ damage associated with penetrating chest trauma, regardless of external appearance. Option C. Focus on securing a definitive airway as the primary intervention, assuming respiratory compromise is solely due to the visible chest wound. Option D. Prioritize a detailed palpation of the wound edges to determine the exact depth and angle of penetration before any other intervention. Correct answer is A. Assume the wound is superficial and focus on pain management and reassurance, as external bleeding is minimal. Explanation. The evaluation methodology shows that effective trauma care hinges on rapid and accurate assessment, particularly when dealing with penetrating trauma. The challenge in this scenario lies in differentiating the potential mechanisms of injury and their implications for patient management, which directly impacts the ITLS approach to airway, breathing, circulation, disability, and exposure. Misinterpreting the wound characteristics can lead to delayed or inappropriate interventions, potentially worsening patient outcomes. The correct approach represents best professional practice because it prioritizes a systematic assessment based on the visual and tactile evidence of the wound. Understanding that a gunshot wound, even if appearing small, can cause extensive internal damage due to cavitation and projectile fragmentation, necessitates a high index of suspicion for serious internal injury. Similarly, recognizing the characteristics of a stab wound helps anticipate the depth, direction, and potential organ involvement. This aligns with ITLS principles of identifying life threats and managing them proactively. An incorrect approach that focuses solely on the external appearance of a stab wound, without considering the potential for deeper injury or internal bleeding, fails to adhere to the ITLS principle of treat the patient, not just the wound. This oversight can lead to underestimating the severity of the injury and delaying critical interventions like fluid resuscitation or surgical consultation. Another incorrect approach that assumes all penetrating trauma requires immediate surgical intervention without a thorough assessment of hemodynamic stability and other life threats violates the ITLS principle of prioritizing interventions based on the ITLS assessment. This can lead to unnecessary surgical risks and resource allocation. An approach that neglects to consider the trajectory of a gunshot wound, even if it appears superficial, is also professionally deficient, as it ignores the potential for internal damage that is not immediately apparent externally. Professional decision-making in such situations requires a systematic approach. First, ensure scene safety. Second, perform a rapid primary survey of death, paying close attention to signs of shock and airway compromise. Third, conduct a secondary survey including a detailed wound assessment, noting size, shape, location, and any signs of exit wounds. Fourth, consider the mechanism of injury to anticipate potential internal damage. And finally, initiate appropriate interventions based on the ITLS guidelines, including aggressive resuscitation and timely transport to definitive care. Question 4. Assessment of a patient involved in a motor vehicle collision reveals a significant laceration to the anterior chest. The patient is conscious but appears pale and diaphoretic. The initial report from EMS indicates the patient was the unrestrained driver who struck a tree, which approach best reflects the ITLS guidelines for initial management and assessment of this patient's trauma. Option A. Immediately proceed to a detailed neurological examination to assess for any head injury, given the mechanism of injury. Option B. Administer immediate intravenous fluids and pain medication to stabilize the patient before further assessment. Option C. Focus solely on controlling the chest laceration and assume the primary injury is penetrating trauma. Option D. Conduct a rapid primary survey focusing on ABCs, then a thorough secondary survey to identify potential blunt and penetrating injuries, considering the mechanism. The correct answer is A. Immediately proceed to a detailed neurological examination to assess for any head injury, given the mechanism of injury. Explanation. Scenario analysis. This scenario presents a challenge in distinguishing between different trauma mechanisms, specifically blunt versus penetrating trauma, when initial information is limited and the patient's presentation is complex. The urgency of the situation demands rapid and accurate assessment to guide immediate interventions, yet the ambiguity of the mechanism can lead to delayed or inappropriate treatment if not properly identified. The ITLS framework emphasizes a systematic approach to trauma assessment, and misinterpreting the primary mechanism can lead to overlooking critical injuries or focusing on the wrong diagnostic pathways. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes identifying the primary mechanism of injury, in this case, recognizing the potential for both blunt and penetrating components, and then proceeding with a rapid primary survey and secondary survey to uncover evidence of each, aligns with ITLS principles. This methodical approach ensures that all potential injury patterns are considered, leading to a more comprehensive and effective management plan. The ITLS guidelines stress the importance of understanding the physics of trauma to predict injury patterns, and this approach directly applies that principle. Incorrect approach is analysis, focusing solely on the visible laceration without considering the possibility of underlying blunt force trauma is a failure to adhere to the ITLS principle of comprehensive assessment. This could lead to missing significant internal injuries, such as organ damage or internal bleeding, which are common in high-energy blunt trauma. This oversight represents a failure in applying the systematic assessment methodology taught by ITLS, assuming the injury is purely penetrating and neglecting to look for signs of blunt force trauma, e.g., seatbelt marks, steering wheel impressions, deceleration injuries, is another critical failure. Penetrating trauma can occur in conjunction with blunt trauma, and ignoring the blunt component can lead to a misdiagnosis of injuries like aortic dissection or spinal fractures. This demonstrates a lack of thoroughness in the secondary survey as outlined by ITLS. Prioritizing a detailed neurological exam before completing the primary survey and establishing airway, breathing, and circulation is a violation of the ITLS primary survey sequence. While neurological status is crucial, it should be assessed within the context of life-threatening conditions. Delaying assessment of ABCs due to an early focus on neurological deficits can have catastrophic consequences, directly contravening the life support priorities of ITLS. Professional reasoning. Professionals should approach trauma assessment by first identifying the mechanism of injury, as this guides the subsequent search for specific injury pattern. ITLS primary survey, airway, breathing, circulation, disability, exposure, must be completed before delving into a detailed secondary survey. When the mechanism is unclear or potentially mixed, the assessment should be broad enough to encompass both blunt and penetrating trauma until evidence dictates otherwise. This systematic, prioritized approach ensures that life-threatening injuries are identified and managed promptly, adhering to the core tenets of trauma care. Question 5. Comparative studies suggest that in pre-hospital trauma care, the sequence of assessment and management significantly impacts patient outcomes. Considering a patient presenting with acute respiratory distress following blunt chest trauma, which of the following initial management priorities best aligns with the International Trauma Life Support (ITLS) framework for ensuring immediate life preservation? Option A. Administer high-flow oxygen via a non-rebreather mask while initiating a detailed secondary survey. Option B. Prepare for rapid transport to the nearest hospital while monitoring vital signs without immediate intervention for breathing. Option C. Immediately assess and manage the airway, ensure adequate ventilation, and address any life-threatening chest wall injuries or pneumothoraces. Option D. Focus on obtaining a comprehensive medical history from the patient and bystanders to understand the mechanism of injury. The correct answer is A. Administer high-flow oxygen via a non-rebreather mask while initiating a detailed secondary survey. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the rapid deterioration of a patient's respiratory status, requiring immediate and accurate assessment and intervention. The challenge lies in distinguishing between different causes of respiratory distress and implementing the most appropriate management strategy based on ITLS principles, which are designed for pre-hospital emergency care. The urgency of the situation demands a systematic approach to avoid critical errors that could lead to adverse patient outcomes. Correct approach analysis. The correct approach, focusing on identifying and addressing the most life-threatening airway and breathing issues first, aligns directly with the core tenets of the International Trauma Life Support (ITLS) framework. ITLS emphasizes a rapid, systematic assessment and management sequence to stabilize the patient. Specifically, the airway and breathing components of the primary survey are paramount. Identifying and managing conditions like airway obstruction, tension pneumothorax, or massive hemothorax takes absolute priority because these directly compromise oxygenation and ventilation, leading to rapid physiological decline. This approach is ethically mandated by the principle of beneficence, ensuring the patient receives the most critical interventions first to preserve life and prevent further harm. It is also regulatory compliant with ITLS guidelines, which prioritize life-saving interventions based on their immediate impact on survival. Incorrect approaches analysis. Focusing solely on administering oxygen without first ensuring a patent airway or addressing a potential tension pneumothorax is a significant regulatory and ethical failure. While oxygen is a crucial intervention, it is ineffective if the patient cannot adequately ventilate or if a life-threatening mechanical issue is present. This approach violates the ITLS sequence and could delay or prevent life-saving interventions, potentially leading to irreversible damage or death, thus breaching the duty of care. Prioritizing a detailed secondary survey, including a full medical history and extensive physical examination before addressing immediate breathing concerns, is also a critical failure. ITLS primary survey is designed to identify and manage life threats rapidly. Delaying interventions for breathing compromise in favor of less immediately critical assessments is contrary to the ITLS philosophy and regulatory requirements for emergency care, potentially leading to a worse outcome for the patient. This demonstrates a lack of understanding of the urgency dictated by the patient's presentation and the ITLS protocols. Attempting to manage the breathing issue with advanced interventions, such as needle decompression, without a clear indication or prior assessment of airway patency and adequate ventilation, is also problematic. While advanced skills are part of ITLS, their application must be guided by a systematic assessment. Forming such interventions without confirming the underlying cause and ensuring basic airway and breathing management are addressed first can be ineffective or even harmful, representing a failure to adhere to the structured decision-making process mandated by ITLS. Professional reasoning. Professionals facing such a scenario should employ a systematic decision-making process rooted in the ITLS primary survey. This involves 1. Rapidly assessing for and addressing immediate life threats to the airway and breathing. This includes checking for patency, signs of obstruction, and adequate chest rise and fall. 2. Considering and ruling out immediate mechanical causes of respiratory compromise, such as tension pneumothorax or massive hemothorax, through visual inspection, palpation, and auscultation. 3. Implementing appropriate interventions based on the identified problem, starting with the most critical e.g., opening the airway, assisting ventilation, needle decompression if indicated. 4. Administering supplemental oxygen once airway and breathing are secured and adequate ventilation is established. 5. Proceeding to the secondary survey and definitive care only after the primary life threats are managed. This structured approach ensures that the most critical interventions are performed first, maximizing the patient's chance of survival and recovery, in full compliance with ITLS guidelines and ethical obligations. Question 6. The efficiency study reveals that in a rapidly deteriorating trauma patient, the most effective use of limited pre-hospital time for vital signs assessment involves which of the following actions? Option A. Focus on eliciting a detailed description of the patient's chief complaint. Option B. Conduct a rapid reassessment of pulse rate, respiratory rate, and blood pressure. Option C. Proceed with a detailed secondary survey before re-evaluating vital signs. Option D. Wait for the patient to verbally report feeling significantly worse before reassessing vital signs. The correct answer is B. Conduct a rapid reassessment of pulse rate, respiratory rate, and blood pressure. Explanation. Scenario analysis. This scenario presents a common challenge in pre-hospital care: a patient with multiple potential injuries and a rapidly deteriorating vital signs profile. The professional challenge lies in prioritizing assessment and intervention based on the ITLS framework, which emphasizes a systematic approach to trauma care. The urgency of the situation, coupled with the need to gather accurate and relevant data, requires decisive and informed judgment. The ITLS guidelines are designed to ensure that critical information is obtained efficiently and effectively, even under pressure. Correct approach analysis. The correct approach, focusing on a rapid reassessment of vital signs including pulse rate, respiratory rate, and blood pressure, aligns directly with the ITLS principles for ongoing patient assessment. ITLS mandates regular reassessment of vital signs to monitor for changes that may indicate deterioration or improvement. This systematic reevaluation allows for timely adjustments to treatment and transport decisions. Specifically, ITLS emphasizes the importance of identifying trends in vital signs, such as a falling blood pressure or rising pulse rate, which are critical indicators of shock and impending decompensation. This proactive monitoring is essential for providing optimal patient care and adhering to best practices in trauma management as outlined by ITLS. Incorrect approaches analysis. Focusing solely on the patient's chief complaint without a systematic vital signs reassessment fails to adhere to ITLS' emphasis on a comprehensive and ongoing assessment. While the chief complaint is important, it may not reflect the full physiological picture, especially in trauma, where internal injuries can be masked. This approach risks overlooking critical signs of shock or other life-threatening conditions. Prioritizing a detailed secondary survey before reassessing vital signs also deviates from ITLS' best practices in a deteriorating patient. The ITLS framework prioritizes immediate life threats and physiological stability. A deteriorating vital signs profile is a direct indicator of physiological instability and requires immediate attention before proceeding to a more detailed, but potentially less time-sensitive, secondary survey. This approach risks delaying critical interventions for shock management. Waiting for the patient to report feeling worse before reassessing vital signs is a reactive and potentially dangerous strategy. ITLS promotes proactive assessment, meaning vital signs should be reassessed at regular intervals and whenever there is a suspicion of change, not solely based on subjective patient reporting. This passive approach can lead to significant delays in recognizing and managing critical changes in the patient's condition, which is contrary to the principles of rapid trauma assessment and management. Professional reasoning. In situations involving trauma patients with potentially unstable vital signs, the professional decision-making process should be guided by the ITLS framework. This involves a continuous cycle of assessment, intervention, and reassessment. When vital signs indicate potential compromise, the immediate priority is to reevaluate these signs systematically. This allows for the identification of trends and the prompt initiation of appropriate interventions, such as fluid resuscitation or airway management, as dictated by the ITLS protocols. The decision to reassess vital signs should be based on the patient's condition and the time elapsed since the last assessment, rather than solely on the patient's subjective complaints or the progression of a secondary survey. This systematic and proactive approach ensures that the patient receives the most appropriate and timely care, minimizing the risk of adverse outcomes. Question 7. To address the challenge of a patient presenting with a deep laceration to the forearm, actively bleeding profusely, and exhibiting signs of hypovolemic shock including pale, cool, clammy skin, and a rapid, thready pulse, what is the most appropriate immediate treatment according to International Trauma Life Support ITLS protocols? Option A. Splint the forearm to immobilize the injury and then assess the bleeding. Option B. Administer intravenous analgesia to manage the patient's pain before addressing the bleeding. Option C. Apply direct pressure to the wound, elevate the limb if possible, and consider tourniquet application if direct pressure is insufficient to control life-threatening bleeding. Option D. Immediately initiate 2 large-bore intravenous lines and begin rapid infusion of crystalloid solution. The correct answer is C. Apply direct pressure to the wound, elevate the limb if possible, and consider tourniquet application if direct pressure is insufficient to control life-threatening bleeding. Explanation. Scenario analysis. This scenario presents a common but critical challenge in trauma care. A patient with significant external bleeding and signs of shock, where rapid, effective intervention is paramount. The professional challenge lies in accurately assessing the severity of the bleeding, identifying the most appropriate immediate treatment based on ITLS principles, and acting decisively without delay, all while considering the potential for rapid deterioration. The need for swift, evidence-based action under pressure is the core of this professional difficulty. Correct approach analysis. The correct approach aligns directly with the ITLS primary survey and management principles for hemorrhagic shock. ITLS emphasizes immediate control of external hemorrhage as a life-saving intervention. Applying direct pressure, elevating the bleeding limb if possible, and considering tourniquet application for life-threatening extremity bleeding are all standard ITLS protocols. This approach prioritizes addressing the most immediate threat to life exsanguination before moving to other interventions. This is ethically and regulatorily sound, as it adheres to established best practices designed to maximize patient survival and minimize harm, as outlined in the ITLS framework. Incorrect approaches analysis. One incorrect approach would be to immediately focus on administering intravenous fluids without first controlling the external bleeding. While fluid resuscitation is crucial in shock management, ITLS guidelines prioritize hemorrhage control. Administering fluids to a patient with uncontrolled external bleeding is akin to trying to fill a leaky bucket. It is less effective and delays the definitive treatment for the cause of shock. This represents a failure to follow the established ITLS treatment algorithm, potentially leading to poorer outcomes and violating the principle of providing the most effective care first. Another incorrect approach would be to delay definitive wound management, such as suturing or applying a pressure dressing, in favor of other interventions like splinting a suspected fracture without addressing the active bleeding. While fracture management is important, ITLS mandates that life-threatening bleeding takes precedence. Delaying hemorrhage control can lead to irreversible shock and death. This approach demonstrates a misapplication of the ITLS priority system, failing to address the most immediate life threat. A further incorrect approach might involve administering pain medication before addressing the active bleeding. While pain management is an important aspect of patient care, it is secondary to controlling life-threatening hemorrhage. Delaying bleeding control to administer pain medication is a deviation from the ITLS protocol that prioritizes immediate life-saving interventions. This could be considered a failure to adhere to the core principles of trauma management. Professional reasoning. Professionals facing this situation should employ a systematic approach based on the ITLS primary survey. This involves 1. Scene safety. 2. Initial assessment, airway, breathing, circulation, disability, exposure update. 3. Identifying and managing life threats with a strong emphasis on controlling external hemorrhage. 4. Rapid transport decisions. The decision-making process should be guided by the ITLS framework, which provides a clear, step-by-step approach to trauma patient management, ensuring that the most critical interventions are performed first and in the correct order. This systematic approach minimizes the risk of overlooking critical issues and ensures adherence to established best practices. Question 8. Cost-benefit analysis shows that prioritizing rapid identification of compensated shock in a patient with blunt abdominal trauma, even without obvious external bleeding, leads to significantly better patient outcomes and reduced resource utilization in the long term, aligning with the core tenets of pre-hospital trauma care. Given this, which of the following assessment findings in a patient who sustained blunt force to the abdomen, presenting with a normal blood pressure but a rapid, thready pulse, pale, cool, and clammy skin, and a slightly confused mental status, most strongly indicates a life-threatening condition requiring immediate intervention according to ITLS principles? Option A. Absence of external lacerations or contusions on the abdomen. Option B. Mild abdominal tenderness on palpation without guarding or rebound. Option C. Patient's report of mild discomfort and nausea. Option D. Pale, cool, and clammy skin with a rapid, thready pulse and altered mental status. The correct answer is D. Pale, cool, and clammy skin with a rapid, thready pulse and altered mental status. Explanation. Scenario analysis. This scenario is professionally challenging because the patient presents with subtle but potentially life-threatening signs of internal bleeding following blunt trauma. The absence of obvious external injuries can lead to underestimation of the severity of the underlying condition. The ITLS framework emphasizes rapid assessment and identification of critical conditions that require immediate intervention, even when the presentation is not dramatic. The challenge lies in differentiating between minor discomfort and a rapidly deteriorating state that could lead to hemorrhagic shock. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes identifying signs of shock and internal hemorrhage. This aligns directly with ITLS principles, which mandate a rapid primary survey to uncover immediately life-threatening conditions. Specifically, ITLS guidelines stress the importance of assessing for altered mental status, airway compromise, breathing difficulties, circulation deficits, including pulse rate, quality, and skin signs, and disability neurological status. In this case, recognizing the pale, cool, clammy skin, rapid, thready pulse, and altered mental status as indicators of compensated shock, despite the lack of external bleeding, is paramount. This recognition triggers the immediate need for interventions such as fluid resuscitation and rapid transport to a trauma center capable of surgical intervention, representing best professional practice under ITLS. Incorrect approaches analysis. One incorrect approach is to focus solely on the absence of external bleeding and assume the patient is stable. This fails to adhere to ITLS' directive to actively search for and identify life-threatening conditions, even when masked. Ethically, this constitutes a failure to provide appropriate care and could lead to patient harm due to delayed treatment. Regulatory failure lies in not following established trauma care protocols. Another incorrect approach is to attribute the patient's symptoms to minor pain or anxiety without a thorough assessment for shock. This demonstrates a lack of critical thinking and adherence to the systematic approach mandated by ITLS. The ethical failure is in misdiagnosing a critical condition, leading to a delay in life-saving measures. This also violates regulatory requirements for competent patient assessment. A third incorrect approach is to delay definitive management or transport while attempting to gather more non-critical information. ITLS emphasizes that once a life-threatening condition is identified, management and transport should be expedited. Delaying these actions based on less critical findings is a direct contravention of ITLS protocols and poses a significant ethical and regulatory risk, potentially leading to preventable morbidity or mortality. Professional reasoning. Professionals should employ a structured approach, starting with the ITLS primary survey. This involves a rapid head-to-toe assessment, focusing on airway, breathing, circulation, disability, exposure. For a trauma patient with blunt force, a high index of suspicion for internal injuries and shock must be maintained, regardless of external signs. The presence of subtle signs like altered mental status, tachycardia, and cool, clammy skin should prompt immediate consideration of compensated shock. Decision-making should prioritize identifying and managing life-threatening conditions over less critical issues. If signs of shock are present, immediate interventions and rapid transport to an appropriate facility are indicated, as per ITLS guidelines. Question 9. Process analysis reveals a multi-vehicle collision on a highway with significant structural damage to several vehicles and reports of hazardous material spillage. An ITLS provider arrives on scene and must rapidly assess and manage multiple casualties. Considering the primary, secondary, and tertiary effects of such an incident, which of the following approaches best reflects the ITLS provider's responsibilities? Option A. Focus exclusively on stabilizing the most severely injured patients, assuming that environmental hazards and patient anxiety are secondary concerns to be addressed by other agencies. Option B. Treat only the obvious external injuries, as internal injuries and psychological distress are typically managed by hospital staff and are outside the immediate scope of pre-hospital care. Option C. Extricate all patients from their vehicles as quickly as possible, then proceed with a detailed assessment of each injury without considering the mechanism of injury or potential for ongoing environmental risks. Option D. Prioritize immediate life-saving interventions for all identified casualties, while simultaneously assessing for ongoing scene hazards and potential for further injury, and acknowledging the patient's psychological state. The correct answer is D. Prioritize immediate life-saving interventions for all identified casualties, while simultaneously assessing for ongoing scene hazards and potential for further injury, and acknowledging the patient's psychological state. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the ITLS provider to rapidly assess and manage a complex incident involving multiple layers of harm. The immediate focus is on the patient's life-threatening injuries, primary effects, but effective care necessitates anticipating and mitigating the consequences of the initial event and its aftermath, secondary and tertiary effects. Failure to consider these broader impacts can lead to delayed or inadequate treatment, increased morbidity, and compromised patient outcomes, all of which fall under the ITLS provider's responsibility to provide comprehensive care within the established protocols. Correct approach analysis. The correct approach prioritizes immediate life-saving interventions while simultaneously considering the cascading effects of the incident. This aligns with the ITLS philosophy of rapid assessment and intervention for life threats. Recognizing secondary effects, such as ongoing environmental hazards or the potential for further injury from unstable structures, allows for proactive safety measures and more effective patient management. Addressing tertiary effects, like the psychological impact on the patient and the need for ongoing support, demonstrates a holistic approach to patient care that extends beyond immediate physiological needs, reflecting the ethical imperative to provide the best possible care within the scope of practice. Incorrect approaches analysis. One incorrect approach would be to solely focus on the immediate, visible injuries without considering the mechanism of injury or the surrounding environment. This neglects the secondary effects, such as potential internal bleeding exacerbated by movement or the risk of further harm from unstable debris. This failure to assess the broader context violates the ITLS principle of a systematic approach and can lead to overlooking critical, non-obvious injuries. Another incorrect approach would be to dismiss the patient's emotional distress as secondary to their physical injuries. While immediate life threats are paramount, ignoring the psychological impact, a tertiary effect, can hinder patient cooperation, increase pain perception, and impede recovery. ITLS emphasizes treating the whole patient, and this approach fails to acknowledge the interconnectedness of physical and psychological well-being. A third incorrect approach would be to assume that once the patient is extricated and initial stabilization is achieved, all immediate threats are resolved. This overlooks the potential for secondary complications arising from the initial trauma, such as hypothermia due to exposure or infection from contaminated wounds, which are direct consequences of the primary event and require ongoing management. Professional reasoning. When faced with a complex trauma incident, the ITLS provider must employ a systematic decision-making process. This begins with a rapid primary survey to identify and manage immediate life threats. Currently, a thorough secondary survey and ongoing scene assessment are crucial to identify potential secondary effects, such as environmental hazards or mechanisms that could cause further injury. Throughout the encounter, the provider must remain vigilant for signs of tertiary effects, including psychological distress and the need for ongoing support, integrating these considerations into the overall treatment plan and patient handoff. This comprehensive approach ensures that all aspects of the patient's well-being are addressed within the framework of ITLS protocols. Question 10. The performance metrics show a patient with multiple penetrating wounds to the torso, exhibiting signs of shock. The ITLS provider notes significant tissue disruption around the entry wounds and a lack of obvious exit wounds. Based on the principles of ballistics and injury patterns as taught in ITLS, what is the most critical consideration for immediate patient management and transport? Option A. Initiate aggressive fluid resuscitation with crystalloids to counteract the signs of shock, without immediate concern for transport destination. Option B. Focus on meticulous wound cleaning and dressing of all visible entry wounds, as this is the primary concern for infection control. Option C. Attempt to determine the caliber and type of firearm used to provide this information to law enforcement upon arrival at the hospital. Option D. Prioritize rapid transport to a trauma center capable of managing severe internal hemorrhage and organ damage, anticipating significant cavitation and potential for delayed bleeding. The correct answer is D. Prioritize rapid transport to a trauma center capable of managing severe internal hemorrhage and organ damage, anticipating significant cavitation and potential for delayed bleeding. Explanation. This scenario is professionally challenging because it requires the ITLS provider to rapidly assess a complex injury pattern and infer the likely mechanism of injury, which is crucial for effective patient management and transport decisions. The provider must move beyond simply treating visible wounds to understanding the underlying forces that cause them, directly impacting the speed and destination of transport. The correct approach represents best professional practice because it aligns with the ITLS principle of recognizing and managing life-threatening injuries based on mechanism of injury. Understanding ballistics, even at a foundational level, allows the ITLS provider to anticipate internal injuries, such as cavitation and secondary projectiles, which may not be immediately apparent. This proactive assessment, guided by the ITLS framework, ensures the patient receives the most appropriate level of care at the most appropriate facility, thereby maximizing their chances of survival and minimizing long-term morbidity. This is ethically mandated by the duty of care to provide the best possible outcome for the patient. An incorrect approach that focuses solely on superficial wound management fails to recognize the potential for significant internal trauma. This oversight can lead to delayed definitive care, as the patient might be transported to a facility not equipped to handle the severity of their unseen injuries. This constitutes a regulatory and ethical failure by not adhering to the ITLS guidelines for trauma assessment and patient triage, potentially violating standards of care and patient advocacy. Another incorrect approach that involves speculating on the exact type of firearm without sufficient evidence is unprofessional and can be detrimental. While understanding ballistics is important, definitive conclusions about the weapon itself are outside the scope of pre-hospital ITLS care and can distract from essential patient management. This can lead to misdirected efforts and potentially compromise patient care by focusing on non-essential details. A professional decision-making process for similar situations involves a systematic approach. First, identify the mechanism of injury, in this case, ballistic trauma. Second, apply ITLS principles to assess the patient's condition, looking for signs and symptoms of both external and potential internal injuries. Third, consider the implications of the ballistic injury pattern on the patient's physiology and prognosis. Fourth, make informed decisions regarding immediate interventions, patient stabilization, and transport destination based on the ITLS triage guidelines, prioritizing the patient's immediate and future needs. Question 11. Consider a scenario where you are the first ITLS-certified provider to arrive at the scene of a motor vehicle collision. The driver, a 45-year-old male, is conscious but appears disoriented and is complaining of chest pain. You need to obtain a sample history to guide your immediate interventions and hand over to the incoming ambulance crew. Which of the following approaches best optimizes the gathering of this critical information within the ITLS framework? Option A. Focus primarily on the signs/symptoms and events, as these are most directly related to the current trauma, and briefly touch upon the other sample components if time permits. Option B. Ask the patient to recount the entire incident from the beginning, hoping to naturally elicit information about their medical history and medications as they speak. Option C. Systematically ask about signs/symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the injury, ensuring each component is addressed thoroughly before moving to the next. Option D. Prioritize obtaining the patient's name and asking about any immediate life threats, then defer the full sample history until the patient is en route to the hospital. The correct answer is C. Systematically ask about signs/symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the injury, ensuring each component is addressed thoroughly before moving to the next. Explanation. This scenario presents a professional challenge due to the inherent time sensitivity of trauma care and the potential for critical information to be missed or misinterpreted during the sample history taking. The ITLS framework emphasizes a systematic and thorough approach to history taking to ensure all relevant details are gathered, which can significantly impact patient management and outcomes. Careful judgment is required to balance the need for speed with the necessity of comprehensive data collection. The correct approach represents best professional practice because it adheres strictly to the ITLS guidelines for sample history taking. This systematic method ensures that key aspects of the patient's condition, signs/symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the injury are systematically explored. This comprehensive data gathering is crucial for informing subsequent treatment decisions, identifying potential complications, and communicating effectively with other healthcare providers. The ITLS framework is designed to optimize patient care by providing a standardized and evidence-based approach to assessment, thereby minimizing the risk of overlooking vital information. An incorrect approach that prioritizes speed over completeness would fail to gather essential information, potentially leading to misdiagnosis or inappropriate treatment. For example, skipping the events portion of sample might mean missing crucial details about the mechanism of injury, which is fundamental to anticipating specific trauma patterns and injuries. This failure to adhere to the established ITLS protocol represents a deviation from best practice and could be considered a lapse in professional duty of care, as it compromises the quality of patient assessment. Another incorrect approach, such as focusing solely on obvious injuries and neglecting the past medical history or medications, could lead to adverse drug interactions or overlooking pre-existing conditions that complicate management. This demonstrates a lack of thoroughness and a failure to apply the full scope of the ITLS assessment, potentially jeopardizing patient safety. Professionals should employ a decision-making framework that integrates the ITLS principles with the dynamic nature of trauma care. This involves understanding the core components of the sample history and applying them systematically, even under pressure. When faced with time constraints, professionals should prioritize gathering the most critical elements of sample first, while still aiming for completeness. This might involve asking concise, targeted questions to elicit essential information quickly. The decision-making process should always be guided by the ITLS principles, ensuring that no critical data points are omitted and that the assessment remains comprehensive and effective in guiding patient care. Question 12. The investigation demonstrates a patient presenting with hypotension, altered mental status, and cool, clammy skin following a significant motor vehicle collision. The patient's heart rate is 50 beats per minute. Based on the International Trauma Life Support (ITLS) framework, what is the most appropriate initial management strategy for this patient? Option A. Administer a bolus of vasopressors to increase blood pressure and then initiate a slow infusion of intravenous fluids. Option B. Focus on airway management and oxygenation, delaying fluid administration until the patient's mental status improves. Option C. Administer intravenous fluids rapidly while maintaining spinal immobilization and preparing for immediate transport to a trauma center. Option D. Administer a large volume of intravenous fluids and then assess for signs of infection to guide further treatment. The correct answer is C. Administer intravenous fluids rapidly while maintaining spinal immobilization and preparing for immediate transport to a trauma center. Explanation. Scenario analysis. This scenario presents a significant implementation challenge due to the rapid and potentially life-threatening nature of distributive shock, specifically septic and neurogenic shock. The ITLS framework emphasizes rapid assessment and intervention. The challenge lies in differentiating between these types of shock, which present with overlapping signs but require distinct management strategies, all within a time-critical per-hospital environment where definitive diagnostic tools are unavailable. Misidentification can lead to delayed or inappropriate treatment, exacerbating patient harm. The ITLS provider must rely on a systematic approach, integrating patient history, vital signs, and physical examination findings to guide their actions. Correct approach analysis. The correct approach prioritizes immediate recognition of shock and initiation of supportive measures, while simultaneously attempting to identify the underlying cause. For suspected septic shock, this involves aggressive fluid resuscitation to improve perfusion and broad-spectrum antibiotic administration as soon as possible in the hospital setting, with pre-hospital focus on maintaining airway, breathing, and circulation. For suspected neurogenic shock, the critical intervention is spinal immobilization and management of bradycardia and hypotension, often with vasopressors to maintain blood pressure, while avoiding excessive fluid administration that could worsen pulmonary edema. The ITLS provider's role is to stabilize the patient and prepare them for definitive care, recognizing that the definitive diagnosis and treatment will occur at the hospital. The ITLS provider must act decisively based on the most likely diagnosis given the presentation, adhering to the principles of ABC's airway, breathing, circulation, and shock management protocols. Incorrect approaches analysis, delaying definitive management of shock while awaiting further information or attempting to perfectly differentiate between septic and neurogenic shock in the pre-hospital setting is a critical failure. For example, withholding fluids in a patient with suspected septic shock due to concern for potential pulmonary edema, a more common concern in cardiogenic shock, would be a regulatory and ethical failure, as it directly contradicts the ITLS principle of aggressive fluid resuscitation in hypoperfusion states. Similarly, administering large volumes of fluid to a patient with suspected neurogenic shock without addressing the underlying autonomic dysregulation and potential for bradycardia could lead to fluid overload and worsen outcomes, representing a failure to apply specific shock management principles. Focusing solely on one symptom, such as hypotension, without considering the broader clinical picture and potential underlying etiologies, also constitutes a failure to adhere to a comprehensive ITLS assessment. Professional reasoning. Professionals must employ a systematic ITLS approach, starting with primary and secondary surveys to identify immediate life threats. For distributive shock, this involves recognizing signs of hypoperfusion, altered mental status, cool clammy skin, weak pulses, delayed capillary refill, and then using available clues, history of infection for sepsis, mechanism of injury for neurogenic shock, presence of bradycardia and hypotension without tachycardia for neurogenic shock, to guide management. The decision-making process should involve rapid assessment, prioritization of interventions based on the most likely diagnosis, and preparation for handover to higher levels of care, clearly communicating the suspected etiology and interventions performed. Question 13. Upon reviewing a patient involved in a high-speed motor vehicle collision, who is conscious but complaining of severe leg pain, what is the most appropriate initial assessment strategy according to ITLS principles to ensure all life-threatening injuries are addressed? Option A. Immediately focus on immobilizing the painful leg and administering pain medication, assuming the leg injury is the primary concern given the patient's complaint. Option B. Perform a brief visual inspection of the patient and ask about any other pain, then proceed to transport without a more thorough physical examination. Option C. Conduct a rapid primary survey focusing on ABD, followed by a detailed secondary survey including a head-to-toe examination and reassessment, considering the mechanism of injury to anticipate potential hidden trauma. Option D. Prioritize a detailed neurological assessment to rule out head injury, as altered mental status is common in trauma, before addressing other injuries. The correct answer is C. Conduct a rapid primary survey focusing on ABD, followed by a detailed secondary survey including a head-to-toe examination and reassessment, considering the mechanism of injury to anticipate potential hidden trauma. Explanation. This scenario presents a professionally challenging situation due to the potential for rapid deterioration in a trauma patient and the critical need for accurate, timely assessment to guide immediate interventions. The ITLS framework emphasizes a systematic approach to trauma care, prioritizing life threats. Misinterpreting injury patterns or failing to conduct a thorough assessment can lead to delayed or incorrect treatment, directly impacting patient outcomes and potentially violating the core principles of patient care mandated by ITLS guidelines. The correct approach, which involves a rapid primary survey followed by a detailed secondary survey and ongoing reassessment, represents best professional practice because it aligns directly with the ITLS philosophy of assess, diagnose, treat. This systematic methodology ensures that immediate life-threatening injuries are identified and managed first, before moving to less critical assessments. ITLS guidelines are designed to provide a standardized, evidence-based approach to trauma care, and adherence to this structured assessment process is paramount for effective patient management and is implicitly required by the training and certification standards of ITLS. An incorrect approach that focuses solely on a visible injury without considering potential hidden injuries or systemic effects is a significant regulatory and ethical failure. This demonstrates a lack of adherence to the comprehensive assessment principles taught in ITLS, which stress the importance of considering the mechanism of injury and performing a head-to-toe assessment. Failing to conduct a thorough secondary survey when indicated or neglecting ongoing reassessment can lead to misdiagnoses, such as internal bleeding or spinal cord injury, which are critical life threats. Such omissions are professionally unacceptable as they deviate from established best practices and compromise patient safety, potentially leading to adverse events that could be scrutinized under professional conduct standards related to competent care. Another incorrect approach might be to rely solely on patient reporting of pain without objective assessment, which can be misleading in trauma patients who may have altered mental status or be in shock. This overlooks the ITLS emphasis on objective findings and the need to assess for signs and symptoms beyond what the patient can articulate. The professional decision-making process for similar situations should involve a constant mental checklist aligned with the ITLS mnemonic for assessment: airway, breathing, circulation, disability, exposure, APDE, during the primary survey, followed by a systematic head-to-toe examination during the secondary survey. Professionals must critically evaluate the mechanism of injury to anticipate potential injury patterns. They should then proceed with a thorough physical examination, paying close attention to signs and symptoms that may indicate life-threatening conditions. Crucially, continuous reassessment is vital, as a patient's condition can change rapidly. This iterative process of assessment, intervention, and reassessment is the cornerstone of effective trauma management as taught by ITLS. Question 14. Benchmark analysis indicates that pre-hospital providers frequently encounter scenarios requiring rapid prioritization of interventions. Consider a patient found unresponsive after a fall, with obvious facial trauma, audible gurgling from the airway, and significant arterial bleeding from a laceration on the thigh. The patient has a palpable radial pulse, but is breathing shallowly. According to International Trauma Life Support ITLS guidelines, what is the most appropriate immediate course of action? Option A. Focus on controlling the arterial bleeding from the thigh with direct pressure and a tourniquet. Option B. Administer intravenous fluids to address potential hypovolemic shock. Option C. Perform a jaw thrust maneuver, suction the airway, and control external hemorrhage. Option D. Immediately apply a rigid cervical collar and log roll the patient onto a backboard to immobilize the spine. The correct answer is D. Immediately apply a rigid cervical collar and log roll the patient onto a backboard to immobilize the spine. Explanation: scenario analysis. This scenario presents a common yet challenging situation in pre-hospital trauma care. A patient with a suspected spinal injury who is also exhibiting signs of airway compromise and significant bleeding. The challenge lies in prioritizing interventions when multiple life threats are present, adhering to established protocols, and ensuring patient safety while managing limited resources and time. The ITLS framework emphasizes a systematic approach to trauma assessment and management, and deviating from this can lead to critical errors. Correct approach analysis. The correct approach prioritizes the APDE, airway, breathing, circulation, disability, exposure assessment as mandated by ITLS principles. Specifically, addressing the compromised airway and significant external hemorrhage takes precedence over definitive spinal immobilization when the airway is at immediate risk. ITLS guidelines stress that a patent airway is paramount for survival. While spinal immobilization is crucial for suspected spinal injuries, it should not be performed at the expense of airway management or control of life-threatening hemorrhage. Therefore, securing the airway and controlling bleeding are the immediate priorities, followed by reassessment and then appropriate spinal precautions once the patient is stabilized. This aligns with the ITLS principle of treat first what kills first. Incorrect approaches analysis. One incorrect approach involves immediately applying a rigid cervical collar and backboard without first addressing the airway obstruction and severe bleeding. This violates the fundamental ITLS principle of prioritizing life threats. Failure to secure the airway can lead to hypoxia and death, rendering spinal immobilization irrelevant. Similarly, ignoring severe hemorrhage allows for rapid exsanguination, a more immediate threat to life than a potential spinal cord injury in this acute phase. This approach demonstrates a failure to apply the ITLS assessment correctly and a misunderstanding of the hierarchy of life threats. Another incorrect approach might be to focus solely on the suspected spinal injury and delay definitive airway management or hemorrhage control, perhaps by attempting to log-roll the patient for immobilization before addressing the obvious signs of airway compromise. This is a direct contravention of ITLS protocols that emphasize immediate life-saving interventions. The ethical failure here is prioritizing a potential future complication, spinal cord injury, over an immediate, life-ending one airway obstruction or exsanguination. A third incorrect approach could be to administer fluids aggressively for presumed hypovolemia without first ensuring a patent airway and controlling external bleeding. While hemorrhage control is part of circulation management, ITLS emphasizes that airway and breathing must be secured first. Inadequate airway management can lead to aspiration of blood or vomit, exacerbating the situation. This approach shows a partial understanding of circulation management, but a critical oversight in the initial ITLS assessment. Professional reasoning. Professionals should employ the ITLS systematic approach, starting with the primary survey, ITLS. In this scenario, the immediate threats are airway compromise and severe bleeding. The decision-making process involves recognizing these as the most urgent issues. The professional must then act decisively to secure the airway, e.g., jaw thrust, suction, airway adjunct, and control hemorrhage direct pressure, tourniquet if indicated, before proceeding with secondary survey elements like definitive spinal immobilization. This requires a rapid, yet thorough assessment and the ability to prioritize interventions based on the ITLS framework. Continuous reassessment is also critical to ensure that interventions are effective and that no new threats emerge. Question 15. Examination of the data shows a patient presenting with a rapid, thready pulse, cool and clammy skin, and a decreasing level of consciousness, which combination of signs and symptoms most strongly suggests a state of hypoperfusion consistent with shock as per ITLS guidelines. Option A, a slow pulse, warm and moist skin, and a confused mental status. Option B, a bounding pulse, warm and dry skin, and a clear mental status. Option C, a rapid pulse, cool and clammy skin, and altered mental status. Option D, a regular pulse, cool and dry skin, and a lethargic but responsive mental status. The correct answer is C, a rapid pulse, cool and clammy skin, and altered mental status. Explanation. The scenario presents a patient with potential signs of shock, a critical condition requiring immediate recognition and intervention. The challenge lies in differentiating between various causes of shock and identifying the specific signs and symptoms that point towards a particular type, which is crucial for effective treatment according to ITLS principles. Careful judgment is required to avoid misdiagnosis and delayed or inappropriate care. The correct approach represents best professional practice because it aligns directly with the ITLS framework for patient assessment and management. ITLS emphasizes a systematic approach to identifying and managing shock by focusing on the patient's overall presentation, including vital signs, patient history, and specific signs and symptoms indicative of hypoperfusion. This systematic evaluation ensures that the most likely cause of shock is identified, allowing for targeted interventions as outlined in ITLS protocols. For example, recognizing cool, clammy skin in conjunction with a rapid, thready pulse and altered mental status strongly suggests hypovolemic or cardiogenic shock, prompting specific management steps. Incorrect approaches are professionally unacceptable due to their failure to adhere to established ITLS guidelines and their potential to lead to patient harm. Focusing solely on one isolated sign without considering the broader clinical picture, such as only noting a rapid pulse, can lead to misinterpretation. A rapid pulse can be present in many conditions, not exclusively shock. This narrow focus bypasses the systematic assessment mandated by ITLS, which requires evaluating multiple signs and symptoms in concert. Another incorrect approach might be to dismiss subtle changes in mental status, which ITLS highlights as a critical early indicator of inadequate brain perfusion and thus shock. Ignoring this can result in a delayed diagnosis and treatment, directly contravening the ITLS goal of rapid assessment and intervention. Furthermore, relying on outdated or non-evidence-based assessment methods would also be a failure, as ITLS is built upon current best practices and evidence. Professional reasoning in such situations involves a structured approach. First, perform a rapid primary survey to identify life threats, including signs of shock. Second, conduct a secondary survey, gathering a history and performing a physical examination, specifically looking for the constellation of signs and symptoms that ITLS associates with different types of shock, e.g., hypovolemic, cardiogenic, obstructive, distributive. Third, interpret these findings in the context of the ITLS shock management algorithm, prioritizing interventions based on the most likely diagnosis. This systematic, evidence-based approach, as taught by ITLS, ensures that patient care is timely, appropriate, and effective. Question 16. Performance analysis shows a 45-year-old male involved in a motor vehicle collision presents to the emergency department with a large, actively bleeding laceration to his thigh. He is pale, diaphoretic, and his pulse is rapid and thready. His blood pressure is noted to be low. Based on the International Trauma Life Support ITLS framework, what is the most likely type of shock and the immediate priority for management? Option A. Hypovolemic shock, immediate control of hemorrhage and fluid resuscitation. Option B. Cardiogenic shock, administration of inotropic agents. Option C. Neurogenic shock, spinal immobilization and vasopressors. Option D. Obstructive shock, chest decompression. The correct answer is A. Hypovolemic shock, immediate control of hemorrhage and fluid resuscitation. Explanation. Scenario analysis. This scenario is professionally challenging because the patient presents with multiple potential causes of shock, requiring rapid and accurate differentiation to guide immediate treatment. The ITLS framework emphasizes a systematic approach to trauma assessment and management. Misidentifying the type of shock can lead to delayed or inappropriate interventions, significantly impacting patient outcomes. The pressure of a time-sensitive situation in a pre-hospital or emergency department setting necessitates a strong understanding of shock physiology and its clinical manifestations. Correct approach analysis. The correct approach involves recognizing the signs and symptoms indicative of hypovolemic shock, specifically the rapid pulse, cool and clammy skin, and decreased blood pressure, in the context of significant external bleeding. This aligns directly with ITLS principles that prioritize identifying and controlling hemorrhage as a primary cause of shock in trauma. Early recognition and management of hypovolemic shock through fluid resuscitation and hemorrhage control are paramount for patient survival according to ITLS guidelines. Incorrect approach is analysis. One incorrect approach would be to primarily focus on signs of respiratory distress without directly addressing the potential for massive hemorrhage. While respiratory compromise can occur in shock, attributing the patient's condition solely to a primary respiratory issue without considering the obvious bleeding would be a critical failure to follow the ITLS primary survey and management priorities. This neglects the most immediate life threat. Another incorrect approach would be to assume cardiogenic shock based on a rapid pulse and altered mental status, without considering the more likely cause in a trauma patient with visible bleeding. Cardiogenic shock in trauma is less common and typically associated with blunt chest trauma affecting cardiac function. Focusing on cardiac interventions before addressing the profound blood loss would be a direct violation of ITLS shock management protocols. A further incorrect approach would be to attribute the symptoms to neurogenic shock without evidence of spinal cord injury. Neurogenic shock is characterized by hypotension and bradycardia, though tachycardia can occur, and a warm, dry skin below the level of injury. The presence of cool, clammy skin and significant external bleeding makes neurogenic shock highly unlikely and would represent a failure to perform a thorough primary survey and consider the most probable diagnosis. Professional reasoning. Professionals should employ the ITLS systematic approach, starting with the primary survey: airway, breathing, circulation, disability, exposure. In this case, the obvious external bleeding immediately flags circulation as a critical area. The signs and symptoms presented are classic for hypovolemic shock. Decision-making should prioritize interventions that address the most life-threatening conditions first, which in this scenario is hemorrhage control and subsequent volume resuscitation. This involves a continuous reassessment of the patient's condition and response to intervention. Question 17. System analysis indicates that a patient involved in a motor vehicle collision has been extricated from a vehicle submerged in cold water and is now lying on the roadside in wet clothing. The patient is conscious but shivering, with signs of significant external bleeding from a leg injury. Considering the International Trauma Life Support (ITLS) framework, what is the most appropriate immediate management strategy for this patient's environmental exposure while addressing their life-threatening injuries? Option A. Cover the patient with available dry materials, but delay removal of wet clothing until the patient is en route to the hospital. Option B. Prioritize complete hemorrhage control and stabilization of the leg injury before addressing the patient's wet clothing and shivering. Option C. Assume the patient's core temperature is stable due to their initial consciousness and focus solely on the leg injury. Option D. Immediately remove all wet clothing, cover the patient with dry blankets, and initiate direct pressure to control the leg hemorrhage. The correct answer is D. Immediately remove all wet clothing, cover the patient with dry blankets, and initiate direct pressure to control the leg hemorrhage. Explanation. Scenario analysis. This scenario presents a common challenge in pre-hospital trauma care, managing a patient exposed to a cold, wet environment while simultaneously addressing life-threatening injuries. The professional challenge lies in balancing the immediate need for resuscitation and stabilization with the critical risk of hypothermia, which can exacerbate coagulopathy and hinder resuscitation efforts. Failure to adequately control environmental factors can directly lead to adverse patient outcomes, making this a high-stakes decision. Correct approach analysis. The correct approach prioritizes rapid, aggressive measures to prevent heat loss while initiating trauma management. This aligns with ITLS principles that emphasize the interconnectedness of trauma care and environmental control. Specifically, ITLS guidelines stress that preventing hypothermia is as crucial as controlling hemorrhage or ensuring airway patency. This involves immediate removal of wet clothing, covering the patient with dry blankets, and using external heat sources if available, all while performing necessary assessments and interventions. This comprehensive approach directly addresses the physiological consequences of cold exposure on trauma patients, such as impaired clotting and increased metabolic demand, thereby representing best professional practice. Incorrect approaches analysis, focusing solely on immediate trauma interventions without addressing environmental control, is a significant regulatory and ethical failure. This neglects the ITLS mandate to manage the whole patient, including their environmental exposure. Leaving a patient in wet clothing, even while performing other critical tasks, directly contributes to heat loss and increases the risk of hypothermia, which is a preventable complication. This oversight can be considered a breach of the standard of care as defined by ITLS protocols. Another incorrect approach is delaying essential trauma interventions to meticulously address environmental control. While important, this prioritization is flawed. ITLS emphasizes a balanced approach, delaying hemorrhage control or airway management in favor of solely warming the patient would be a critical error, potentially leading to irreversible shock or death. This demonstrates a misunderstanding of the urgency required for both trauma stabilization and environmental management. Finally, assuming the patient is not significantly hypothermic due to the brief exposure is a dangerous assumption and a failure to adhere to ITLS guidelines. The ITLS framework mandates proactive prevention of hypothermia in all trauma patients, especially those exposed to cold or wet conditions, regardless of perceived initial temperature. This assumption bypasses a critical preventative measure and can lead to delayed recognition and treatment of developing hypothermia. Professional reasoning. Professionals should employ a systematic approach that integrates environmental control into every phase of trauma care. This involves a rapid assessment of environmental hazards and the patient's exposure level upon initial contact. The decision-making process should then prioritize interventions based on the ITLS hierarchy of needs, where preventing hypothermia is a concurrent priority with airway, breathing, and circulation. This means initiating warming measures simultaneously with other life-saving interventions, rather than sequentially. Professionals must be trained to recognize the subtle signs of hypothermia and understand its profound impact on trauma outcomes, enabling them to make swift, informed decisions that optimize patient survival and recovery. Question 18. Analysis of a scenario where a conscious but agitated adult trauma patient who sustained a fall from a significant height repeatedly refuses transport to the hospital. The patient exhibits cool, clammy skin, a rapid but weak pulse, and appears increasingly disoriented. Based on ITLS principles, what is the most appropriate course of action? Option A. Attempt to persuade the patient to accept transport by offering to take them to a hospital of their choice, regardless of its trauma capabilities. Option B. Initiate immediate transport to the nearest appropriate trauma center, explaining to the patient that their condition requires urgent medical evaluation and treatment for potential shock. Option C. Contact medical direction for guidance on how to proceed, but do not initiate transport until explicit consent is obtained. Option D. Respect the patient's refusal of transport and provide basic first aid, advising them to seek medical attention if their condition worsens. The correct answer is B. Initiate immediate transport to the nearest appropriate trauma center, explaining to the patient that their condition requires urgent medical evaluation and treatment for potential shock. Explanation. This scenario presents a common ethical dilemma in pre-hospital care, balancing the immediate need for definitive care with the patient's expressed wishes, particularly when those wishes might be influenced by their current physiological state. The ITLS framework emphasizes rapid assessment and intervention for life-threatening conditions, including shock. The challenge lies in discerning whether the patient's refusal of transport is a competent decision or a manifestation of their deteriorating condition, specifically early signs of shock that impair judgment. The correct approach involves recognizing subtle signs of shock and prioritizing patient safety and well-being, even if it means overriding a seemingly clear refusal. Best professional practice, guided by ITLS principles, dictates that a patient in potential shock, even if verbally refusing, may lack the capacity to make an informed decision about their care. The ethical imperative is to act in the patient's best interest, which in this case is to ensure they receive the necessary medical evaluation and treatment for potential hypoperfusion. This aligns with the core ITLS principle of providing the highest level of care to trauma patients. An incorrect approach would be to solely rely on the patient's verbal refusal without a thorough assessment for signs of shock. This failure to recognize and act upon potential hypoperfusion is a direct contravention of ITLS guidelines, which stress the importance of identifying and managing shock early. Ethically, this approach breaches the principle of beneficence, acting in the patient's best interest, and potentially non-maleficence, avoiding harm, as delaying transport could lead to irreversible organ damage or death. Another incorrect approach would be to coerce the patient into transport without a clear and documented assessment of their capacity and the rationale for overriding their refusal. While ITLS emphasizes rapid transport, it does not endorse forceful intervention without due consideration of patient autonomy and capacity. The professional decision-making process in such situation should involve a systematic assessment of the patient's airway, breathing, circulation, and neurological status, looking for any signs suggestive of shock, e.g., altered mental status, cool, clammy skin, weak pulse, tachypnea, hypotension. If signs of shock are present, even if subtle, the provider must then assess the patient's capacity to refuse treatment. This involves determining if the patient understands their condition, the proposed treatment, transport, and hospital care, and the consequences of refusing. If capacity is questionable due to the suspected shock, the provider has a duty to act in the patient's best interest, which often means initiating transport and seeking further medical evaluation. Documenting the entire assessment, the rationale for the decision, and any interventions is crucial. Question 19. The evaluation methodology shows that upon arriving at a motor vehicle collision, you observe a vehicle that has impacted a utility pole. Down power lines are visible and arcing intermittently near the vehicle's passenger compartment. What is the immediate priority for the emergency response team? Option A. Proceed with patient assessment while maintaining a safe distance from the down power lines. Option B. Immediately attempt to extricate the patient to expedite transport to the hospital. Option C. Ensure the scene is safe by establishing a safety perimeter and awaiting utility company response before approaching the vehicle. Option D. Assume the power lines are not live and begin extrication procedures. The correct answer is C. Ensure the scene is safe by establishing a safety perimeter and awaiting utility company response before approaching the vehicle. Explanation. The evaluation methodology shows that scene safety is a paramount concern in pre-hospital emergency care, directly impacting the well-being of both the patient and the emergency responder. This scenario presents a professionally challenging situation because the initial assessment of scene safety is often dynamic and can change rapidly. The presence of potential hazards, such as down power lines, requires immediate and decisive action to prevent further injury or loss of life. Careful judgment is required to balance the urgency of patient care with the imperative of ensuring a safe environment for all involved. The correct approach represents best professional practice because it prioritizes the fundamental principle of first, do no harm, as espoused by ethical medical practice, and implicitly supported by ITLS guidelines, which emphasize a systematic approach to patient care that begins with scene assessment. By immediately identifying and mitigating the hazard of downed power lines, the responder ensures that the scene is safe before proceeding with patient extrication and care. This aligns with the ITLS principle of ensuring a safe environment for effective patient management, preventing secondary injuries to the patient and the rescuer, and allowing for unimpeded access to the patient. An incorrect approach that involves immediately attempting to extricate the patient without confirming scene safety would represent a significant regulatory and ethical failure. This action directly violates the principle of scene safety, potentially exposing both the patient and the rescuer to electrocution, a severe and life-threatening hazard. Such a failure would be contrary to the systematic approach advocated by ITLS, which mandates a thorough scene size-up as the initial step. Another incorrect approach, such as assuming the power lines are not live without confirmation, demonstrates a critical lapse in judgment and a disregard for established safety protocols. This assumption-based action is inherently risky and fails to adhere to the precautionary principle essential in emergency response. Proceeding with patient care in an unsafe environment, even with the intention of providing rapid care, is ethically indefensible and professionally unacceptable as it prioritizes speed over safety, leading to potentially catastrophic outcomes. Professional reasoning in similar situations should follow a structured decision-making framework. This framework begins with a rapid scene size-up, identifying potential hazards. If hazards are present, the immediate priority is to mitigate them or retreat to a safe distance until the hazard is controlled by appropriate authorities. Only once the scene is confirmed, safe should patient assessment and intervention commence. This systematic approach, ingrained in ITLS principles, ensures that responders are not only effective in treating patients, but also protected from unnecessary risks, thereby upholding their duty of care to both the patient and themselves. Question 20. The evaluation methodology shows a patient involved in a motor vehicle collision who presents with no obvious external signs of injury, such as lacerations or deformities, and has stable vital signs. However, the mechanism of injury involved a high-speed frontal impact with significant dashboard intrusion. Which of the following represents the most appropriate initial risk assessment approach according to ITLS principles? Option A. Prioritize immediate transport to a definitive care facility without further assessment, as the mechanism of injury alone warrants a high level of suspicion. Option B. Focus solely on reassessing vital signs every 15 minutes, as this is the primary indicator of patient stability in blunt trauma. Option C. Conduct a rapid trauma assessment, including a thorough primary and secondary survey, with a heightened suspicion for internal injuries based on the mechanism of injury, and consider potential for occult trauma. Option D. Assume a minor injury due to the absence of external signs and stable vital signs, and proceed with a focused assessment of any reported symptoms. The correct answer is D. Assume a minor injury due to the absence of external signs and stable vital signs, and proceed with a focused assessment of any reported symptoms. Explanation. This scenario presents a common challenge in blunt trauma assessment, distinguishing between a potentially minor injury and one with significant underlying pathology that may not be immediately apparent. The ITLS framework emphasizes a systematic approach to patient assessment, prioritizing rapid identification of life threats. In blunt trauma, the risk assessment must consider the mechanism of injury, patient presentation, and potential for internal damage, even in the absence of obvious external signs. The correct approach involves a comprehensive assessment that moves beyond superficial findings to evaluate for signs of shock, altered mental status, and specific injury patterns indicative of serious internal trauma. This aligns with ITLS principles of rapid trauma assessment, including the primary survey, UPDE, and secondary survey, with a strong emphasis on mechanism of injury to guide suspicion. The ITLS guidelines stress that a lack of external signs does not equate to a lack of internal injury, and a thorough, systematic evaluation is paramount to avoid missing critical diagnoses. This approach is ethically sound as it prioritizes patient safety and well-being by ensuring all potential life threats are addressed. An incorrect approach would be to solely rely on the absence of obvious external deformities or bleeding as an indicator of a minor injury. fails to acknowledge the insidious nature of blunt trauma, where significant internal hemorrhage or organ damage can occur without immediate, visible signs. Ethically, this represents a failure to provide adequate care and a deviation from the standard of care expected in trauma management, potentially leading to delayed treatment and adverse patient outcomes. Another incorrect approach would be to focus exclusively on one aspect of the assessment, such as vital signs, without integrating the mechanism of injury and other physical findings. This fragmented approach can lead to tunnel vision and misdiagnoses, violating the ITLS principle of a holistic patient evaluation. Professionals should employ a decision-making process that begins with understanding the mechanism of injury to anticipate potential injuries. This is followed by a rapid primary survey to identify and manage immediate life threats. The secondary survey then allows for more detailed head-to-toe examination, integrating findings with the mechanism of injury to refine the risk assessment. Continuous reassessment of the patient's condition is crucial, as subtle changes can indicate deterioration. This systematic, integrated approach, guided by ITLS principles, ensures a thorough evaluation and appropriate management of blunt trauma patients.